savings grouping for impact. This is which we have discussed previously on these webinars over the last 3 years. But I think savings groups are kind of a new, fairly new intervention and being used to reach vulnerable in new ways and in really innovative ways. I think we're excited to have with us today S.C. Tianju, who's with Freedom from Hunger, to talk about some of the really exciting work that's being done. That's really pretty cutting edge. Jesse, program, her full title is Deputy for Programs at Freedom from Hunger, and has been with Freedom from Hunger since 2008. She worked in the world, Africa, India, Latin America, and she was implementation of quality programs and partnerships for Freedom from Hunger. She developed a course which we're excited to be able to offer. She has actually piloted the course in Nigeria recently, and we're going to offer the course in the SMDP Zambia in about a month. We'll give more information about that course.
Great. I'm going to get technical to work for us here as well. All right. As said, this pulling some of the information in today's presentation from a course called Design for Impact, which is the idea behind this is really that savings groups is a very promising
poll. Great, okay.
Percent of our audience has finished answering, so I'm going to close the poll. You give me seconds, I'll post the results. Okay. about finished the poll, so I'm going to close it right now and show you the results shortly.
Just for a moment of silence here while we were waiting to tabulate the poll results. So if you don't hear talking, it's because we're not. a couple of them. So one question that came in from Marissa is, can you give more description of what the vulnerable destitution category means? Can you kind of give us more detail of what that actually means in terms of what kind of income and what's the kind of situation these kinds of people would be in? All we have right now. The good George to be connected, and his I think we're able to bring him in when we're ready. So so George, unmute your mic, and really happy to have you join us. Could you actually start off with where you're from, where you're participating from? I might have soon. Bianca is.
Yes.
George, hear us. And that our technology is not going to cooperate because the screen he's connected here, but we're not hearing him. George, are you? George, see. I need to see if we have any questions. Nope, I don't think at the time, so I guess we'll forge ahead. Here's a question. I think institution people have lost all their livelihoods and do not have any strategy to cope and need external assistance. I wonder how saving strategy can start for them, particularly in post-conflict recovery context, in my context, from Mashika. Arisa she's actually working in Rwanda, and she said that in experience, the destitute or the vulnerable groups could really not save, which I think supports what you're saying is that people just really don't have any assets at all, so can't do nothing. So. Sad that we can't. George can hear us. He just cannot. Nothing is coming out of his microphone. And John Schiller asked what we would have heard from George if he could join us. George, working for the past 5 years in a program that is a partnership between MIFU, the Microfinance Association of and the National Union of Disabled People of Uganda, with from NORAD and from others, and work there, Uganda. And the program that was designed is called We Can Manage. It is a program specifically for disabled people to be able to join savings groups. The aspect of it related to presentation today is that the We Can Manage program has a very inclusive policy. They want disabled to be in the leadership of savings groups for a variety of reasons. The most important reason is that disabled people have an opportunity to be in a leadership role and have an opportunity to see what it's like to run an organization and be in charge of something. But it's also the policy of the We Can Manage program that the members of the savings will include non-disabled people, be caregivers of disabled people, or could be people who are from the community, who are friends, neighbors, whatever. And the idea is, again, for people who may not be as acclimated or familiar with the ability of disabled people, seeing them in leadership positions within savings groups, seeing them being able to run a large and robust organization is great for mainstreaming and having people understand that disabled people really have a lot of ability to participate in society. It's a great example of exactly what we're talking about in kind of strategies that Jesse's been discussing, because it really kind of aims to give people this kind of step forward. The whole idea of We Can Manage is to step forward not only to be a member of a group, but to be a leader of a group, and in some cases to become community leaders, which has happened in We Can Manage. And the program was originally supposed to recruit about 5,000 people in I think 3 or 4 years, and it's now up to around 30,000 or more in that period of time. So it's really been a success story, and it's really something that George and people at NDIFU and CARE can be really proud of. So as a synopsis, George would have been able to tell this much better. He's probably on the other end trying to communicate, saying, "Bill, you don't have it quite right," but hopefully I did it as closely as I can. I really apologize. I wish we could get George in. We can't seem to solve the technology problem here. There are just a couple of other questions that I so this is from Rutherford. She says, hence with cash transfer programs, possibly food for work and work even with limited cash, there's a need for safe savings. As needs are met, savings plays a more important role. So can you comment? Laura says, what about having people save from the cash transfers to get folks in the habit? I'm sorry, just lost my place here. Sorry. From the transfers to get folks in the habit will help them into a savings group later. Could we start them with just a starter savings process and then into group or Mika has asked, what can one do after creating a savings group? One finds that both destitute people and very vulnerable are mixed. Do you think we have to separate them to help us implement the two different theories? You're just rolling in here, Jesse, so this is still trying to bring in George. We haven't given up on George. George, we're trying you. If you can hear and call in the number I sent you, then we'll bring you in. Should be a way to connect Skype and WebEx, but we don't know how to do that right now. So, but David Nisley regarding youth or children, just what age are we talking about? What is this age possible, and what are the ideal number of members in these kinds of groups? Yeah, I visited some groups in the Dominican Republic that were youth groups, and there were children young as 6 or 7. The chair person was a young girl who was 12 years old, and she ruled iron fist. And it was sort of what Jesse says. They were getting the money from their parents, and it was really to get them into that kind of habit of savings. But one was urban group area in Santo Domingo, the other was out in the countryside, and in both cases the children really took it quite seriously, and the meetings were run really quite well, really got the sure, and they understood it, and there wasn't a lot of guidance being done by us. So they really had kind of figured out what needed to be done, and they were able to handle it. So it's pretty exciting. Some more questions are coming in, so I'm just going to respond. Schiller, he was about the 30,000 here that I talked about for the BK managed groups, and this is third include disabled and non-disabled. It does. Breakdown is about 60-70% disabled to about 25 to 30% undisabled. And what I will do is definitely put information about the Weekend Managed program up on the website, along with the recording for this webinar and the PowerPoint that Jesse shared with us, so you can learn more about the program and about the question at the end that John asked about whether Weekend Managed is in SAVIX. I'm not exactly sure. I'll have to check with Hugh to see if those are recorded in SAVIX. Diana Rutherford had a comment, which was there may be an opportunities to develop mixed savings groups in which there are places in savings groups for the most vulnerable who cannot save regularly, but perhaps in lumps as a result of the social safety net programs. And then elite capture when the parents capture a savings group for the kids. So, Marissa, does this assume a homogeneous savings group with all belonging to the same category, or are we looking at mixed memberships? Yeah, and there's enough interest in George, we can manage program that we will. I'll make a promise that we will have a dedicated webinar to talk about the model. They're doing a really interesting randomized control test right now that is just in process, but it's looking at the participation in school enrollment and how school fees are being able to be increased, or savings for school fees are being able to be increased by weekend managed members. So that that data is available, which will be a few months from now. We will schedule another webinar and bring George in and maybe some of the researchers who are doing that work, so we can get into that in more detail, and we can hear we can manage hear about we can manage and hear about exactly what is the learning in the field. Another message. Let's see a message from George. The reality is that cash transfers are not commonplace in many developing countries, including Uganda. This is the savings groups that we did in Dominican Republic were part of a conditional cash transfer program, and it's one of the only examples of a CCT program and savings groups. But a new idea that's being introduced in Africa. I know that Fundación Capital, the organization working in the DR and working throughout Latin America, is doing a lot of exciting work around CTs that do in other types of savings programs, but not necessarily savings groups. So, and that might be another topic where we could bring people from Fundación and talk about CCTs and the other things work they're doing. I have another question from Jordan. Vulnerable groups can also be considered isolated groups, like a road infrastructure. So access is extremely limited unless you have the proper vehicle. Where does it fit into the vulnerable population, where they may come but still struggle with basic needs such as water, electricity, nutrition, etc.? I don't know if people saw this in the chat, but George did answer, kind of exaggerating. I have some Irish in my blood, tend to exaggerate about things, but there's actually 28,940 people in We Can Manage groups. There's 981 groups. 1,653 are disabled. 81 are caregivers, and the rest are non-disabled. So, looking at 60% of the people who are in the group are disabled. So that's great. Okay, we're at the end of our questions. People are asking some great questions. If anyone has a final question, then please go ahead and ask. I could do is just, as we're waiting for other questions to come in, to talk a little bit about the course that we're offering. And so if, Bianca, if you could put up the thing that shows our description. So if you're a regular listener to the SMDP webinars, you know that we kind of a thing that SMDP does is we offer workshops on savings groups, and we're excited to be able to come to Lusaka, Zambia, between October the 26th and November the 13th. I'm sorry, to be able to offer an SMDP workshop right before the Savings Group 2015 will be held at the same hotel, the Intercontinental in Lusaka. So this is a really good opportunity. We have kind of different levels of courses. We have more introductory courses such as Savings Group Program Design. I also have a program private service provider course that will be taught by Mark Bavois, and then more advanced courses like a Management Information Systems course, and the course that we lead, which is Savings Group Design for Impact with Vulnerable Populations. This is a course that I would like actually Jesse would tell us a little bit more about it, but it has been piloted in area, and I think it really is designed for people who are already running savings group programs, who are really more advanced practitioners, but really want to look at how they can reach populations that are difficult to reach down into communities they're not able to reach with other types of programs. So could you just give us a little bit of an idea that you hope to cover in Zambia and what we're going to do? Just to repeat, this course is going to be offered from November 2nd to November 6th in Lusaka, Zambia. SMD Zambia 2015 is, they said, coming right on the heels of the Savings Group 2015 conference, which was sponsored by the SEEP Network. And I know that there are some scholarships available to the Savings Group Conference available through SEEP. I don't know if that window is closed or not. I know that we are offering a discount if you come to 1 or 2 weeks of the SMDP and you stay on for the Savings Group 2015 conference, then we will discount the tuition for the Savings Group Conference to $375. We also, to the courses that I mentioned, the program design course, the private service provider course in the first week, the MIS course, Savings MIS course taught by Hugh Allen in week 2, and then, of course, the course that Joe mentioned. We have sessions that will be, I think, really quite fascinating sessions looking at what is happening across the in Zambia as far as their savings group work, looking at the program design tool, an Excel-based tool designed by Chuck Waterfield and Hugh Allen that will be introducing at the Zambia workshop, and a real workshop called the Change Makers Symposium. This is a Pacmana Institute, is an organization from Latin America that is looking at climate change and looking at impact on development, how we as practitioners can start to get ready for some of the incredible and difficult challenges we're facing. So I would urge people, if you can be part of the Awakening the Dream, Changing the Dream Symposium, even if Osaka and you aren't doing SMDP during the day, you're welcome to come to those workshops, which will be on Tuesday night, November the 3rd, and Wednesday night, November 4th. We'll send out information to everybody in SMDP, mailing about that. I'll just go back to a couple more comments and questions, and then we can wrap it up. We're going to go over probably by 2 or 3 minutes just so people know. But I will get back to a comment that George made about the managed groups, and he just wanted to add that mixed groups are preferred since they give a chance to the vulnerable to learn what happens in the practical world, and they allow for internal knowledge transfer and healthy competition in as far as performance is concerned. And Leah Greenberg had a question for Jesse, which is she wanted to know about tracking outcomes for clients. Are the savings groups doing that systematically? And if so, what are they finding? Was the primary outcome develop savings habit? Is there increased empowerment to participate in the community or growth in savings? And that's a great segue to say that at the Savings Group 2015 conference, there is going to be quite a significant focus on research. A plenary on Wednesday morning, November 11th, towards that. There will be some specific breakout sessions to look at the different types of research that are going on, and also to talk about what kind of research is needed. So we have probably put up several notices about Savings Group 2015 agenda, or the program. We will be sure to the agenda so you can see that, but we really encourage you. This is the fourth in a series of Savings Group conferences. The first started at Tufts back in 2009, and the second one was the Arusha Savings Group Summit 2011, by a Savings Group conference in Washington in 2013, and now the Savings Group 2015 in Lusaka. Really excellent opportunities to network and connect with partners from around the world doing the best Savings Group work, really challenging each other to think about where we're going as a Savings Group movement. How do we measure impact, and how do we pay attention to the changes in lives for the communities and the people that we're working with? So I would really urge you to make sure to be a part of that experience. We are running over, so I want to be able to wrap up. I want to remind people that we have a recording of this webinar on the SMDP site. We are also going to have the PowerPoint presentation, so you can see that. And certainly, if there were questions that didn't get answered, Jesse would be available to answer those questions. Or come to Lusaka and be able to ask her directly. We would really appreciate people coming and spreading the word about both the SMDP Lusaka, in Lusaka, and also the Savings Group 2015. So I want to thank Jesse for being our moderator today, and I want to thank George for being there. Even if we're sorry the technology would not cooperate with us to bring you today, but we promise that we will have a dedicated webinar in the future on Weekend Manage and terrific work they're doing to reach disabled people in Uganda. I want to thank everybody for being part of today's webinar. We will have upcoming webinars. We're working on a webinar for October that is quite different from our usual topics. Next week here at the University of New Hampshire, we are sponsoring the Social Franchise Innovations Roundtable. We're bringing people from around the world who are working on this model called social franchising to campus to see if we can catalyze and innovate to the model of social franchising to bring it to a scale around the world. We hope to have a webinar in mid-October with Scott Hillstrom, who's with the Health Stores Foundation, doing terrific work in East Africa to set up small clinics by registered nurses to offer certified drugs and healthcare services at very minimal costs using a franchise model. Julie McBride, who used with Population Services International, now is with MSA Worldwide, an expert in social franchising, doing this work for the past 2 decades or more. So we'll tell you more about this soon. We'll have an announcement up in a week or so, but pay attention to your email. We'll send you information about it. And again, thank you very much. Thank you, Justin. I appreciate everybody tuning in, and have a good afternoon or evening wherever you are.